Hey guys, what's up? It's Maddie here, and I've been thinking about how to do this video for about a week now because my appointment was last Saturday, my breastfeeding class was, and I can't remember everything for the life of me that they said to me, but it's like in my head, but I can't remember how to say it all, you know? So I'm going to give it my best shot, and I hope that I can help you guys out a little bit. They gave me some really good information, and if you want to know anything specific, message me or comment, and I will look through all my stuff and see if I can find a specific answer for you. Because if I don't cover it, I still may have the answer, I just didn't go over it. So yeah, let's go get into it. Okay, so I have this list of topics that I'm going to kind of go over. Some information that I think are important. I'm trying to just hit really important topics, and this is in no way, one, I'm not an expert, so don't watch this video as in like, oh my god, this is how you have to breastfeed, or this is how it goes, and this is how to do it. Talk to your healthcare provider. Like, if you're pregnant, talk to your OB or your nurse practitioner. I see a nurse practitioner, so talk to them, and kind of get a feel for it. And when you're in the hospital, there will be a lactation specialist that comes to see you, and talk to them. Ask as many questions as possible, because I plan to, because I'm very serious about wanting to breastfeed. So definitely do that. And also, sorry, I wanted to explain that this is not me trying to convince anyone to breastfeed. If you don't want to breastfeed, don't do it. You don't have to. I see benefits in it, and I see a lot of good in it, which is why I want to breastfeed, and it's free, which I don't think anybody could really pass up free food for your child that's very nutritious and healthy for them. So that's why I choose to do it. But if you don't want to breastfeed, and you don't want to watch this video because you feel like I'm kind of gonna be preaching breastfeeding, because I don't know if it'll come off that way, you do not have to watch. I'm getting a cold again. That's like my third one this entire pregnancy. Which is a lot, because I normally only get 1 to 2 colds a year. Okay. I guess we'll just go for it. A good amount of time to breastfeed in a day, I did not know this, is 8 to 12 times a day. If you're not feeding him or her at least 8 times a day, normally it's not enough. But you cannot overfeed your child if you're breastfeeding. I thought that was pretty interesting to learn in the class, because you're trying to learn. If you don't know that you can't overfeed them, you're going to be like, okay, they've been doing it for an hour, let's stop. You can never overfeed your child. So if you're feeding them anywhere from 8 to 12 times a day and they're gaining weight, you are doing well. Your breastfeeding is going well. I learned that. If they're gaining weight and everything, you're right on track. And also, I wanted to talk about the milk that you get before you get your mature milk, which is literally just like milk. What you get before is this thing called colostrum, which is really good for the baby. It's a lot creamier, it's a lot thicker. It's not as much as you get of mature milk. And what I found out about it is that it it helps the babies treat and also act like a first vaccination. I've known this from my sister-in-law that the colostrum was important for them to get. I never really knew why. I find it very interesting that it acts as like a first vaccination, like it's protecting the baby, and I really like that, because obviously we all want to protect our children. But that kind of ties in with kind of this next point I wanted to talk about, is that when we were in the class, the lady that discussed this with us said, you will always make the milk your child needs. And I loved that when she explained it, because, excuse me, because if your child is sick, your body will sense that your child is sick and will produce antibodies, I'm pretty sure is what she said, to help him get better. the way they explained that is if someone has a cold and you're with someone, a friend who has a child, she has a cold, is slobbering all over a toy, and you don't want your son or daughter to get it. Well, if your child gets the toy before you have a chance to not have him have the toy, then he's gonna get sick. When you put him to your breast and you go to feed him, your body will sense that he has this sort of virus or whatever in him, and it will make the milk that he needs to get better. Or if you have a preemie, your breast milk is the milk that the preemie needs to get bigger. It's just interesting that your body knows what kind of milk to make. And it's a natural thing that your body produces milk. It's not where some people do produce milk and other people don't produce milk. The way it works is that every time you pump, every time, I don't know, I guess there's ways to manually pump your boobs with just like your hands and milk can come out. Didn't know that. But if you could do that, or obviously have the baby on the breast, it signals something, I cannot remember the names of all these things, something in your body that triggers the ducts to make milk, and then the milk will come out. So the more you breastfeed, the more you pump, the more milk you make, the more your body realizes you're using that milk. And when mature milk comes in, I'm pretty sure colostrum goes away within no more than a week. I want to say the first few days, but I know it's no more than a week. Storing your breast milk. I thought this was very interesting because I know only people that really did formula. And when you store formula, it's like it cannot be left out for more than 2 hours. In the fridge, it can't last for more than a day. And obviously, you don't store formula in the freezer. It's that powder form. Why would you make it and put it in the freezer? I learned with breast milk, you can store in room temperature for 5 hours, in a fridge for a whole week. In the freezer, like when you have a fridge and a freezer combo, you could store that for like 6 months to 12 months. I'm not exactly 100% sure where the cutoff is with that, but I know that if you have a deep freeze that's below 0, you can store breast milk for an entire year. How crazy is that? I didn't know you could store milk for that long. So the milk that you're pumping right away could last till their first birthday if you have a below 0 freezer. And some say in a regular freezer it can last a year. So, I mean, just kind of talk to the nurse the lactation specialist. Duh. So just talk to her about your freezer and see how long you could store it. I wanted to talk about something that I was really kind of afraid of getting. I had heard about it. Chapped nipples. I know we're getting very vulgar here. Chapped nipples is something where I know it's extremely painful, and it's like little cracks in your nipples and you can bleed. And I know a couple people they haven't quite gotten chapped nipples, like the really, really bad version. They've gotten some, and then they put some cream on it by Lancino, which is the same brand of my breast pump. But chapped nipples, I learned, is actually not very common. It's not that it's not common to get. It's normally caused by one thing, and that is a bad latch. I did not know that. And we went over latching, like what's a good latch, and I would explain it to you, but it's kind of hard to explain it to you without a nipple to show you. I know it's a little vulgar, but when we were watching the video, they had like an animation of a nipple and a baby, and it kind of showed you how to do it. So the latch has to be, the nipple has to get so far back into the mouth that it's hitting kind of like the back of, I don't know, it's hard to explain. Not just the tip of the mouth, it has to go all the way back in there close to the throat. Not like in the throat, but you know what I mean. Because then they're getting every little bit of milk and all that stuff. And if you don't get a good latch, there is just delatch right away. Like, if you don't feel like it's a good latch, even if it was a good latch, if you don't feel like it was one and you feel like it was a little off, you can delatch your baby by kind of like pressing in on their cheek a little, and it'll just get them to break the suction, or kind of sticking your finger in their mouth and pulling them away, and then just relatch them. And yeah, which I thought that was a pretty thing that they covered, because a girl had asked about it. Engorged boobs. kind of a way to avoid it and also try not to have it. This was something that she had discussed with us, which I did not know. So like I said, this class was so helpful for me. With engorged boobs, you're going to feel a little fuller when your mature milk comes in because it's going to be real milk coming in and not just this little bit of colostrum. So with when your boobs are engorged, your body is sending signals that you are producing too much milk and that you don't need to make so much, so your body will back off and not make as much milk, which is not what you want. You want to be able to produce a lot of milk, one, if not to feed your child right away, to breast pump and save for a time where, you know what, maybe you're too sick or you're not feeling very well, or let's say you were in the hospital or whatever reason, you have that breast milk as backup. Or you just want a night away and you have someone babysitting, you just give them some breast milk. But the way that you could kind of avoid it, one tip that they gave us, and that I can only really remember, is when the baby feeds on one side, you always start opposite sides every time you feed. I'll say that one next. You put them on the breast, and then they could tend to fall asleep and be done. You can sometimes wake them up and then put them on the other one, but sometimes they're not going to want to actually get up, or they may be full after that first one, especially the first few weeks, because their stomach is like this big, it's tiny. So what you're going to want to do is pump the other side, so that side has drained as well as your other side, and that one doesn't become engorged, or your other one doesn't become engorged, so those don't become engorged. And that's kind of a way that they had said to prevent engorgement, is to be able to pump whatever one they're not eating. Or if they don't eat enough, you know, if you feel like you're not making enough milk, pump afterwards. Like, there's just things that you can do that help with your milk supply. Taking a shower or brushing your teeth, you kind of just know to do it. That you write down, or you, I don't have my phone on me, I think it's charging, or you get an app. Always make a note of which side that you did it on, that you started on, and start on the opposite side this next time. The reason of that being is so you don't overproduce in one boob and not the other. I thought I'd throw that little statement out. I don't know if that's obvious and you guys are like, duh, but I'm trying to come up with everything. And the last thing I kind of just wanted to cover, and like I said, if you have any questions, leave a comment or send me a message, and I will look through my stuff and I will answer it. Yeah. So, if you are really wanting to breastfeed and you are pregnant and you are wanting to breastfeed and you are wanting to do it solely breast milk and you are so for it, do not supplement with formula. Not at all. Not if you feel like you aren't making enough. First call your lactation specialist or call the hospital that you gave birth at and ask to speak to a lactation specialist if you don't have one yourself. Obviously they're going to have a ton of information on you because you gave birth there. Talk to one of them, and I know sometimes they'll have you come in for a feeding and they'll see how you're breastfeeding them and they can kind of give you tips from there. But also, the minute that you give them formula, it changes the fatty deposits or pockets or something in their stomach that to take in the breast milk, because the breast milk is, or to take in the formula is thicker and it's different and it's not as thin and, I want to say watery, but breast milk isn't watery, but you know what I mean. It's the consistency is more watery, where formula is a little bit thicker. And so it needs, your baby needs to develop different things to absorb the formula than to absorb the breast milk. So once they take formula in, and once they make those fatty pockets in their stomach deposits, I'm not sure, your baby will never take to breast milk the same, ever. And who knows, maybe if you just give them formula once, they'll never want breast milk again, which is a very well process, and that may frustrate you even more. So, those are all the things that I could think of off the top of my head that were really truly important, and the video, I didn't want to be a half hour, So I just kind of wanted to touch on a few things here and there. If you have any questions, like I said, for the millionth time, just let me know, comment them, I'll answer. Send me a message, I'll answer. They gave me so much. This is only half of it, not even half of it. They gave me so much information to go over. I am willing to help you guys out if you would like it. So I'm gonna go. I have to babysit today, and I'm super excited to go hang out with my nephew. If you don't follow me on Instagram, which there's a thing down below that has my name. If you follow me on Instagram, you see I've been babysitting my nephew lately, and he's been hanging out with his cousin. So I'm gonna go, and I will see you later, alligator.